Hi, everyone. I wanted to talk a little bit about the learning styles and study barriers. So we do have a version of this PowerPoint, but it's silent, just in case you didn't want to hear the chime of my Boston accent. This here is going to be talking to you a little bit about visual, auditory, reading or writing learners, and then the kinesthetic learning. So you may have done something like this already. They have a lot of learning assessments that are available. I certainly have one as well. It is linked in here on the personalized study template link right here on this slide. So with this here, the way it breaks down is really for visual learners here. They learn through diagrams, videos, written notes, really seeing things. Some of them have a real kind of picture memory, a photographic memory, where they can remember exactly how they saw it in something. For auditory, of course, that's hearing. And so that would be more listening to lectures or discussions, maybe even listening to podcasts. Reading and writing. So these people are miracles. They can read the textbooks, read the notes, read the lists, and get it well. Certainly, I know that's difficult for a lot of people. So we have many different types of learners, and a lot of people are a combo. So the last type is kinesthetic, which is where you hands-on, where you really learn from doing or from simulations or from muscle memory and movement. Certainly people can be a combination of these and likely are. However, knowing your strongest learning style could really help you to kind of adjust how you're studying and maybe make some improvements just because you know more about yourself and how you learn. So the dominant style is what we would want to focus on, picking that dominant style. And of course, the study template is here and available for your use. So please do click on that and utilize that. For visual learners, let's talk about that first. So see it to understand it. Your strength as a visual learner is that you can process the information that you're seeing really quickly. You're good with diagrams, you're good with charts, concept maps, flow charts, algorithms, all those things are great visually for you to break down information. Using color-coded notes or maybe different colors for different systems, that can be very helpful for that visual cue. Also, YouTube, of course, things like Khan Academy is listed on here, but certainly anything that's pertinent to what you're getting through Blackboard, you want to focus on what your instructor is giving you primarily. And anything to, go off of that really should be provided resources that are vetted and really helpful to your program here. So I know people use Quizlet, that's on here as well, flashcards with Quizlet. You can absolutely use that service to make your own digital flashcards. That's helpful for vision. You could always make a PowerPoint and do visuals. You could ask AI to create images for you based off of things. The only issue with those, and I want to caution you, is outside resources or outside applications like AI and different apps. They can be inaccurate at times. So I just want you to really caution yourself to try and focus on what we give you here at Cambridge. And if you need any support outside of that, a great idea could even be maybe sending it over to me or sending it over to your instructor. And we can look at it and say, you know what? This is a great resource. I think that this works well for you if it, is really helping you. Or maybe we can pinpoint, this differs from your text. So let's still focus on the text information and maybe not use this particular video. So maybe that could be something if you find those other sources really helpful. I just don't want to take away from the curriculum or the way that we're teaching, the information here, because that can really be helpful when we're giving you information that is repetitive, that's streamlined through the text, all the way through the presentation of your instructor, the lecture, and then any activities going from there. So that is all very thought out in the process here at Cambridge. And so sometimes when you're going on YouTube, onto other channels, maybe they're not using the same text or breaking things down. And so certainly we want to make sure that you have the best benefit. So that's my best caution to you. But otherwise, please utilize what you can for visual aid. When it comes to auditory, this is hear it to own it. So they're great listeners, excellent with discussion, good memory for spoken words. So you can really remember what the lecturer has said. So you can record the lectures if your instructor is okay with that. You can certainly listen to them while you're driving, exercising. I listen to them during sleep. That was a recommendation when I was in nursing school, to record the lectures and listen when you go to bed. The other thing was to read out loud and record your own words with text, and maybe listen to the text. And sometimes that can be very helpful. There's also study groups, discussions that you can have, that if, hearing other people talk and break things down is helpful, that could be great for you. Listening to nursing podcasts. That's a very new age thing. Certainly wasn't around when I was in nursing school, but they're great. And remember just about the accuracy, okay? Anything online, you got to vet. So let's just be careful with that stuff. But reading notes aloud, like we just said, teaching the content to somebody else so you can hear yourself explaining it. Sometimes that's really helpful too. Using text to speech, also explaining the concepts into the voice recorder like we were talking about, and then replaying that. You could do that when you are at the doctor's office. You could pop in your, hair, whatever they are, earbuds, earphones, this and that, plug something in and listen to that back to you. You can absolutely do that. And I think that's a great asset if that really does help you. For reading, writing, write it out, it says. So detail-oriented, typically really organized note takers, and typically very good at reading comprehension. So taking detailed, organized notes can be very helpful. You can certainly, create study guides for yourself in ways that make best sense to you, but also writing them out is going to be your skill set. Making a list of key points or medications, making sure that you are writing in your own words as well as the medical terminology in the way that the text is teaching you, because you'll want to be able to connect those two concepts together. So also written case studies. Maybe you just write out something for yourself or copy something from online, but you writing it and the act of you doing that is actually very helpful for you. So do that and work them step by step while you're writing it and while you're doing it, and really cement that in. And of course, flashcards. Tried and true. They're tale as old as time, flashcards, but they're great. So if you like handwritten ones, color-coded, they still sell index cards everywhere. So please go ahead and make your own flashcards that way. Be very, very diligent with how you end up learning through writing, and see if you can really mimic that in the way that school needs. So if you were really good at just jotting notes down in real time and then rewriting that afterwards, that's a great tactic as well. For kinesthetic, this is what we were talking about, doing it to learn it. And this is very common for a lot of people. You'll hear a lot of people say, oh, I have to do hands-on. I have to do it in order to really learn it. I'm not going to learn just by listening. And so that's just an example of, the layperson saying that they're a kinesthetic learner. So this is when you really excel being hands-on and learning it through the experience. Clinical simulation, actual clinicals, of course, lab practice, all of those things really helps to get this through. Kinesthetic learning is more like muscle memory, if you can think like that. And so on the unit as a nurse, you'll do a lot of these mock codes and drills and different hands-on experiences, because that's how it really helps to cement as well. So this is definitely something that will be in your career. And using models, using teaching dolls, as you've seen in Sim, all of our mannequins. We are definitely going to be doing a lot of those. Just even patient scenarios like the case studies or unfolding case studies. Those are great. And the flashcards always make their way back here, right? But really practicing on actual patients and clinical, that's the benefit for that, is that you're actually doing those tasks that you've learned in lab, so it repeats itself. But a lot of these things, even though you don't have a mannequin at home and you might not have a lot of the equipment here, you do have your lab bag, and you are able to create your own scenario where you can go ahead and practice a lot of these skills. So if you have a willing live participant, even better, make it fun. If you have your kids, say, I need to practice my head to toe assessment, or, just try to incorporate things. I know it's hard juggling everything, but sometimes when you let things overlap, it can really take the stress away a little bit. And make it a little bit more fruitful, that you're doing things in a way that's very, very helpful for you, your family life, your work life, or what have you. So maybe think of some out-of-the-box ways to incorporate kinesthetic learning into your home experience as well. Discovering your learning style, of course, using the study plan template that's in there. You can do your whole questionnaire. There's also learning style quizzes online. So certainly you could look at those. VARC is one of them. 16 personalities is another. Those are right here. But here's the template again. So you could always use that. Think about what's worked best for you in the past. Think about the last time you're a learner. And if it's a while ago, just know that things do change sometimes. And so it's okay if you do another assessment and say, okay, well, I haven't been to school in 15 years. Now, how do I really learn? How best do I do things now that I'm older and things have changed a bit? So certainly give yourself some grace, maybe do it again anyway, and just see how things are, how dominant you are in one style, and try to switch things up. And if you need any help at all, you know where to come. All right, let's see what else is here. Barriers. Okay, big time. Recognize your barriers. This is huge for self-assessment. And distractions like your family, being on the phone, TV in the background, it can really lose focus and motivation for a lot of people. It can be very overstimulating and certainly takes away from their focus time. So that can add to your test anxiety because you don't feel like you're really confident in the information. Maybe you just felt like you were too distracted to really get it in there. But also the test anxiety on its own. Maybe you have all the content and you've had an immense amount of time to study without distractions, but just that self-doubt and that test anxiety is really a barrier to that positive mindset that we need to be successful. So we can certainly work on that. Competing demands. Absolutely. Nobody here has nothing to do outside of school. I'm sure of that. But also learning disabilities. If you recognize that you are already have a documented learning disability, please do, reach out and say something. There's support here for you. And then just looking into those, poor study habits and ineffective techniques. This takes a lot of, I'd say, determination. Self-motivation. You need to be self-driven for a lot of these things with a lot of discipline. So the discipline comes in to say, oh, I know if I have my phone even in sight, I'm going to look at it. Put the phone in another room, lock it in your car, go inside, set a timer for 30 minutes and study. If it's safe, of course, to do that. You don't want to lock your phone away and need it for an emergency. But I'm just saying to be really creative with some of these barriers. Some of them don't have to be super difficult to mitigate or to stop the barrier from happening, to resolve it. So I tend to have a lot of, ideas, and I'm very happy to help you if you have some personal concerns and you're not really sure how to get around them or incorporate them into nursing school. So please come and talk if you feel comfortable. For the phone use, here's some, just little tips on how to deal with that. So being in a library or a different room, like we were talking about, nice quiet location, putting the phone in a different room or on airplane mode. Potentially on silent if people like me who have a bunch of kids really need that phone accessible to them, but they can't really be on it. I know there's focus mode and some different things on iPhones, so you can always explore your phone's features. App blockers is another option. Setting the do not disturb or even expectations for yourself. So maybe you do a schedule where between, I'm just going to put this out there, 4 and 6 p.m. I study, right? So your family knows she's not available, he's not available, they are not available. We can't really do dinner. We can't go here. We can't go there because, they're studying. And so after 6, they're available. It's just a kind of respectful communication that you can use if you are juggling with other people in your life. But also if you're not juggling with anybody else and it's just your personal calendar, setting some expectations for yourself, leaning into your integrity, leaning into your character to say, no, I need to have this time. I need to study. And it says in my calendar, 30 minutes, like this is the time. So if that does work for you, certainly go ahead and do that. For some people, it's not enough of a motivation, and we can think of some other ideas as well. For that loss of motivation, perfect timing, right? Studying in short blocks. I used to do 40 minutes with 20 minutes off, and I would do that for 6 hours at a time. That pace is not for everybody, but maybe 25, 30-minute blocks. Maybe that's a little bit more realistic. Studying with your methods and then using different ones and really seeing what it caters. Maybe one certain method is not great on a subject. Maybe you really need a lot more visual in one of the content, areas versus another one where it's just like critical thinking and really getting through that information. Connecting your why. The why, meaning what is your motivation? Why did you even come into nursing school? So try to get that. If you're a vision board person, if you're a positive mantra person, add that in there and just give yourself that motivation daily to say, I'm doing this for this. This is why I'm doing this. So try to come up with that and stick that in there as your daily reason to really give it your all, tracking progress visually, like we were just talking about, vision boards or even charts, just showing your improvement, progress pathways. There's lots of ways to be able to do that and see that. So that way it's motivating, that you're meeting your goals and you're staying steady on your path, rewarding yourself, even in small ways. So after you do a focus session or you study and you're like, okay, I've done it. I did exactly what I set out to do. I set my time, and that's precisely what happened. And so if that's your experience and you're proud of yourself, which you should be, give yourself a break. Give yourself a little treat, a little pleasure. Hopefully it's a healthy one. But a walk, maybe your favorite latte or a nice protein shake, I don't know, whatever you're into, a nice Netflix binge. Sometimes that resets me, a nice movie or a nice TV show to binge. I don't do it often, but sometimes it's nice. So I get it. But honestly, whatever it is that kind of fills you up a bit, try to do a snippet of that and really integrate that. It's important. The complex concepts. Okay. Using multiple resources like we talked about. I am doing my best and I will continue to get information on this channel for you that is very much aligned with your curriculum here. Certainly your assigned textbooks, using different ones to really bounce off of each other if that's appropriate. Concept maps, huge into concept maps. They are excellent to really visualize the relationships between things and break things down and get that analytical thinking going. Asking your instructor or a tutor to explain things differently. Maybe just hearing a different perspective on the information is all you need. Teaching the concept to a classmate and maybe just talking about that with somebody else really helps to fill in those gaps or identify those and be like, oh, I didn't even think about it like that. And then there you go, you're up and on your way. Connecting to real patients. So thinking about, oh, I saw this actually. I remember the nurse did this and then they did this. So try to think of it in that way as well. Try to break it down the best you can if you have the experience. For test anxiety and negative self-talk, we need to have a positive mindset. I know it's not always easy. It's a struggle, but it's worth it because any negative self-talk really can be shifted into a positive perspective. It's just about a choice to be able to do so. You want to be able to have a positive mindset. So as long as you have that, I promise you, I will help you with the skills to develop one naturally. But the want to have one is the first step you need. So what does this look like as far as anxiety? For testing or studying, exam performance, we really want to practice timed, the time sessions like we talked about and not cramming. You don't want to cram, you don't want to lose sleep over things. So you really want to be able to build your confidence with multiple practice exams, practice questions, and really getting that confidence down that you have the timing, you've done the time sessions, you've been studying, you've been doing the work. That's really what's going to help overcome test anxiety naturally, is being really prepared in the process of applying to the questions. So a lot of people study the content, study, but they're not sure how to answer the questions. So doing practice exams and practice questions is really how you can try to step over that gap. The breathing techniques. There's definitely some things on the channel about breathing techniques, but there's box breathing, there's 4x4 breathing. 4x4 breathing is when you breathe in for 4 seconds, you hold for 4 seconds, breathe out for 4 seconds, hold again for 4 seconds. So Breathe in, hold, breathe out, hold. Box breathing or 4x4 breathing. So there is quite a bit with that. There's also ways where you can breathe in, you hold for longer, you breathe out for longer. So there's some different techniques there, but just know that any amount of time you are inhaling to its capacity and releasing that air, it literally gives your brain a boost. So this is not just about, taking in some air and letting it back out in a different way. This is really about optimizing your brain's oxygen, the flow to it, the processing of it, and how it helps your brain to really feel calm and in a better state. And then you're able to release as well. So there's a lot of studies around breathing, of course, but that's sort of how you can do it. And it takes seconds, literally 4x4x4, right? And so when you're in class, this is something that you could totally do in a private way, in a quiet way, where it doesn't call much attention, but it's really effective. So I hope that that'll help you and you'll try that out. For reframing negative thoughts, I'm struggling. I can't do it. This is so hard. You could say instead, I'm learning. I'm being challenged to really learn new things. This is challenging, but I'm ready. I want to be a nurse. So using your why and helping it to reframe negative thoughts can also help as well. Sleeping before exams. Everybody thinks, just I only need a couple of hours, but I really need to study. You are doing yourself a big disservice. Your brain, your computer, it needs to be rested. It needs to be ready to be booted on for your test. So if you're stealing all of its power, all of its zest, if you will, and then you're going into the exam really tired, feeling prepared, how are you going to perform at your best? Our brains and our bodies don't work that way. We really do need quality rest. And so if you balance your sessions out and you have proper sleep, it's actually a better way to go than just trying to cram all day, last 2 days before an exam. Talking to a counselor, of course, please talk to somebody trusted and reputable. If your anxiety is more severe, it is treatable. You can absolutely get help. I'm here as a soundboard if you need anything at all, of course, and I'm happy to get you additional resources if you need, but just whoever you feel comfortable with. There's also 211 resources. There's lots of things on the Florida, website for the state. So you could absolutely get some more resources that way too. But if you feel comfortable, just pop in and we'll chat. For the learning disabilities or ADHD, obviously there's a ton of things that fall under that. I just want you to know that if you already have a diagnosis, you could always talk about accommodations. You could ask about that, talk to your provider, of course. But if you're concerned about learning disabilities, that would be something to talk to your provider about just in general and say, hey, I'm going through school and I'm really struggling here. I'm not sure if it's more than just school and it's actually something that I haven't noticed before. Can we talk about it? Or what have you, whatever you're comfortable with. But just know that there's people to help you, and getting help is strength, not weakness. That's what it says right there on the bottom. I promise you, I mean that. It doesn't behoove anybody to just think that it'll just go away by itself. Let's just get on it and get in front of it so that way you can be successful here. Exhaustion from work and family. My goodness, yes. Too tired to focus, or studying feels impossible. You just really need sleep and you don't know how to get more time out of your day. Pick the times of day that you have the most alert, engaging kind of energy. Think about when your peak is, and certainly prioritize the sleep, like we said, over the longer studying times. It's just not effective the way that people think it is. Quality short sessions will definitely beat out marathon studying anytime. So asking for help, like we said, and certainly move your body. So there's a great way to just get a 5-minute reset. And sometimes that's getting up, walking outside, getting the sun on your face, just getting some fresh air, and then going back inside. That alone can be enough to reset you and kind of refresh you for another mini session, another 30 minutes or so. But certainly, please do be active. Make sure you're moving your body and make sure you're being kind to your body, making some healthy choices for sure. Outside of sleep and outside of exercise, really give the best fuel to your body that you can. The power of blending the styles, like we were saying before, with visual, you could be drawing things, you could be looking at pathways. For the auditory, you could be listening to the lecture or the podcast explanation. You could be writing your notes. You could certainly be doing diagnosis cards, if you will, where you put the diagnosis down and you put what their symptoms are, what the causes are, the risk factors, the treatment, the meds. You could make your own situation like that and really do a great job at getting the content in a way that you learn best. So the kinesthetic, of course, practicing things in simulation in lab, at home, like we said, getting creative with that. But using all of these, it really creates that deeper learning, better memory, because you are not going to depend on memorization alone through this. There are elements, of course, of memory where you just have to remember what the content is. But to memorize each detail, that's not what we're focused on. We're focused on exam readiness through understanding the content. And that's what I'm here to help you with. And so are your instructors. So create your plan, know how you learn, identify the barriers that you have, do your best to remove them, do your best to soften them if they can't be removed. Study smarter. Try not to study harder. I know it's really difficult, but studying smarter for you doesn't mean studying smarter the same way for somebody else. So please individualize this. And if you get stumped, let us know. We're here to help you. Use it to your advantage. It is your learning style. It is your strong suit. Identify it, learn about you, and really implement that for yourself, because that's how you're going to have some great success with using your learning styles to be successful in nursing school and NCLEX. So certainly contact me anytime. My link is right here for some appointments if you want to go ahead and set up a session with me. But certainly you can reach out anytime. Your instructors are here as well to support you. We all want to see you succeed, but we know it takes a lot more than just reading and note taking. It takes a lot more than that. So we're here to help you figure that out.